Endoscopic Retrograde Cholangiopancreatography, ERCP, is a technically challenging procedure with significant complication rates of 5 to 10%. It takes time to learn the basic skill and at least 180 to 200 cases for trainees to achieve competency in ERCP. Different methods, including didactic lectures, video discussion, and simulation practice with in vivo and ex vivo animal models and computer and mechanical stimulators, have been used to teach trainees the basic skill of ERCP. However, hands-on practice in patients remains the gold standard for ERCP training. Selective cannulation of the desired duct is a prerequisite for a successful ERCP. It is well accepted that trainees should be given sufficient time and opportunity to learn and practice in order to gain experience and proficiency in selective cannulation. However, inexperienced trainees and repeat prolonged attempts at cannulation could increase the risk of complications, including post-ERCP pancreatitis, PEP. Optimal training, therefore, involves a fine balance between benefits to the trainees and potential risks to the patients. There is no consensus on the optimal time allocated for trainees to attempt cannulation during hands-on ERCP training. The reported time has varied from 5 minutes to 10 minutes in different centers. In the Endoscopy Center of Zhiguo Hospital, the time allocated for trainees to attempt cannulation was arbitrarily set at 15 minutes from January 2010 to December 2011. A retrospective analysis showed that the trainees' selective cannulation success rate was about 70%, with an overall post-ERCP complication rate of about 6%, unpublished data. In contrast to previous reports that extending the cannulation time to 15 minutes would increase the post-ERCP complications, Tan et al. Hypothesized that allowing a longer time, 10 or 15 minutes, for trainees to attempt cannulation would improve the success rate of selective cannulation. With active coaching and hands-on assistance from the trainer during trainee practice, the risk of complications may not increase. In the prospective endoscopist blinded randomized controlled study entitled Appropriate Time for Selective Biliary Cannulation by Trainees During ERCP, a randomized trial, the authors aim to determine the impact of different times allocated to trainees for attempted cannulation on the ERCP success rate and performance score. Here is a short report of the results. Background and study aim. The allocation of sufficient time for trainees to attempt cannulation is necessary for learning and to ensure success with ERCP training. However, it is important to balance the benefit to trainee practice against the potential risks to patients. The appropriate time for attempted cannulation by trainees remains unclear. Patients and methods. 3 different time limits, 5, 10, and 15 minutes, were set for cannulation attempts made by 4 trainees in patients with native papilla undergoing ERCP. Patients were randomly assigned to the 5, 10, or 15-minute groups in a 1:1:1 ratio. Rectal indomethacin was used in high-risk patients. The primary outcome was successful cannulation within the allocated time. Secondary outcomes included performance scores, overall success rate, and post-ERCP pancreatitis. Results. A total of 256 patients were randomly assigned to the 5-minute, n equals 84, 10-minute, n equals 86, or 15 minutes, n equals 86 groups. Patients' baseline characteristics were comparable. Success rates for selective bile duct cannulation by trainees were 43.8%, 75%, and 71.8% in the 5, 10, and 15-minute groups, respectively. Trainees' self-reported performance scores and video assessment by an independent reviewer were comparable between the 10 and 15-minute groups, which were higher than the 5-minute group. Trainers took over the cannulation procedure when trainees did not succeed within the allocated time. There was no significant difference in the overall success rates in cannulation between the three groups. No differences were noted in the use of rectal indomethacin and overall complication rates. 4 patients in each group developed PEP. Conclusion. A time of 10 minutes was considered to be appropriate for trainees to attempt a cannulation